Assalamu alaikum. You are now tuning to Shakil and Company on America's Islamic Radio. I'm your host, Kevin Shakil, and today's exciting interview is sponsored by Aikner Relief, Issue Realtor, Elements Dental, JG Advisors, and Tech Bites. Today we have Dr. Khalid Ahmad, who came back with us because obviously we're still dealing with COVID, and we spoke to him when COVID first started, and we knew it wasn't really affecting kids as much, but now the news reports are happening that it's affecting kids. So we asked Dr. Khalid back, and alhamdulillah, he accepted. Assalamu alaikum, Dr. Khalid. How are you?
Hey, walaikum salam, Kevin. How are you?
Alhamdulillah, how are you doing?
Ramadan Mubarak.
Ramadan Mubarak.
Hope it's going well for you and the family.
Alhamdulillah, everything is going well. How are you guys doing?
We're doing alhamdulillah well, alhamdulillah. So it's been a lot of forced time to be together, which is good. Alhamdulillah, we're together. We're not really around other people, even other extended family members. But it's nice to be around my kids and my wife, alhamdulillah.
Listen, I know you have a very busy life schedule with work and whatnot. And how has your Ramadan been while you're being home?
I actually took some time off for Ramadan at this point because it was an opportunity to do so at this time. I mean, I'm still working, but I cut back my hours a little bit, and now I'll be off next week, inshallah.
Inshallah. Well, you're off on the best nights, the last 10 nights of Ramadan.
Yeah.
Inshallah, accept your fast and your du'as, inshallah.
Inshallah.
So, Dr. Khalid, I want to get right into it, right? Obviously, COVID is still going around. We're still in the pandemic right now. We still have stay-at-home orders. What's going on? I mean, do you see any end to this at all?
The end is going to be when we get to something called herd immunity, and that's either going to be where enough people get infected or they get the vaccine. So there's about 60 to 70% of the population that has had the infection. And then the virus really doesn't have a lot of places to go if people have been infected already, hopefully. I mean, I think we're still looking to see if with the infections, with the antibody responses, whether that is a barrier to get infected again at this point. But the hope is that, and the vaccine, that's really the hope. We're obviously trying to reopen in certain places, and some people are doing it a lot sooner than they should be. It's what you have in a democracy. You have people who decide whatever they want to do. It gets pretty messy. But we're probably going to see a lot more of this going on for a while, especially if we start opening up a lot sooner. And we really have to wait for the vaccine. I mean, that would be the vaccine, or if we find some really good treatments. Since we last talked, there's a little bit of hope. There's one antiviral agent called remdesivir, which has been shown in some clinical trials to reduce the length of the illness or being in the hospital in a relatively large study that was done in the States. Although there's some conflicting evidence somewhere else, but that's kind of like a hopeful thing. So we have one treatment that can be used basically in the hospital at this point. We're still looking to see where else it can be used. But hopefully there will be other treatments coming down. Hopefully we'll be getting some more results from clinical trials soon.
So, I mean, obviously the CDC guidelines are still the same, where they're recommended to wear masks to go outside, gloves, hand washing. Is that really being effective, or is that just something just for everybody to do?
Well, most definitely it's been effective. I mean, you can see it if you've been, following the pattern. Obviously, we're in New York. I'm not sure where else this was going out to, but places that have done a great job with that. Especially New York, if you see the curves, the New York curve has come down because people have really followed directions. They've tried to stay apart. And whereas the rest of the country, if you take it as a whole, is still having more and more cases, meaning the slope is still going up. New York has been coming down for a while now, for a few weeks now. And the governor's, taking it cautiously and starting to open up certain businesses in certain areas at this point. So yes, it is working, but you have stories about it coming back or having more cases. There's some cases in China, in East Asia in general, where like Korea did a really good job with testing, contact tracing, isolating people, and they had a pretty low mortality rate. They were being praised, but now they're also now as they've started opening up, they're starting to see more cases. So it definitely is helping, and but at the end, I think in the long term, what's going to be the silver bullet, if you want to call it, or is it's going to be the vaccine, or if we can get really good therapies that are effective against this virus sooner, because the vaccine's still probably a year away.
That's my other question. So we're looking at the vaccine coming maybe after a year.
Right. I mean, there are some hopes, as I heard, that maybe by the fall, some frontline. I mean, they were shooting for frontline workers being able to get it, but I'm not sure where that is at this point. The realistic for the world to get or for the population to get is probably at least a year from now. I know the president just came up with some force, and he's hoping by the end of the year that we have a vaccine or so. It seems like other people don't think that's going to be possible, but hey, we'd love it if we get it sooner.
You just mentioned the fall, right? Obviously, where flu season is the best and most strongest during the fall and the winter. Obviously, we're approaching that after the summer ends, right? How bad do you think we're going to have it in, let's say, October, November, December, with the flu and being in COVID?
That's why everyone should get their flu shot. You know, everyone should get their flu shot to try to reduce the risk of the flu. But it can, if you see some of the curves that are like, there's a curve that I don't know if you have seen it, but if you look back at the curve for the pandemic Spanish flu from 1917 to 18 or so, there was a initial small wave, and then you had a really high wave, and then you had another wave after that. So it was like three peaks. So if the virus is in the community, I mean, there's a chance it can be pretty bad with the second wave. But I would hope, although, you know, depending on who you listen to in terms of leadership, we could be better prepared than we are right now. And it would be heartless. It would be unexplainable, unimaginable if now we know that it's going to be happening again and we're not prepared for it from a national perspective.
Well, I mean, obviously, we're watching the governor's reports, right? And we live in New York City, and there was a reported case of 75 kids being affected with a new illness that's probably linked to COVID. Can you elaborate on exactly a little bit what that is for our viewers?
Yeah. So it's you know it's not necessarily the virus. In a way, the virus may be causing it. We're not sure exactly what. There's last month, the UK, initially there was a report of 8 cases of this, what it's called multi-systemic inflammatory syndrome in children. Okay, that's what it's called now at this point. Basically, what that means is this: there's an inflammatory response in the body, and a lot of different organs in the body are being affected. And that includes, and this is apart from the lungs. We know coronavirus is a respiratory virus and it causes pneumonia. We know novel coronavirus does that, but this is apart from the lungs. It can affect the kidneys, it can affect the heart, it can affect neurologically, you can have seizures. It also affects the blood vessels, where it can affect the blood vessels of the heart that bring blood to the heart. And what we're seeing with this multi-systemic inflammatory syndrome in children is that these kids are winding up getting really sick and winding up in the hospital and the ICU. There have been a couple of deaths, but thankfully the vast majority still do fine and they are discharged. So that's the silver lining with it. And you know, it's interesting. The reports have come from Italy, a few handful. It was reported in the UK. I believe they report up to like 75 to 100 cases now in the UK. And in New York State, as of 3 days ago, there was 102 cases reported. Don't have all the details about it in terms of you know, we're obviously it's all fresh, brand new. The researchers, very smart people, are looking into it and identifying it. But thankfully, it's still rare. So, like you had said when you first started off the interview, kids were doing fine. and still that still tends to be the case. The vast majority of kids tend to do fine. So far, these cases tend to be pretty rare. But what may happen as the infection spreads, as the country gets more and more infected, those rare infections or those rare cases will show up more. And I believe 17 states have already reported similar cases. Um, the CDC just came out with an advisory yesterday regarding this, summarizing some of the stuff in the UK and New York. And New York State's come up with a diagnosis or some clinical criteria to identify these cases so we can learn more about them. Things you should watch out for, I mean, in terms of parents with their kids. I mean, these kids get sick enough to wind up in the hospital. If they have a persistent fever, have a red throat, a red tongue, cracked lips, red eyes, like injected eyes, but not a lot of pus coming through. They can have variable looking rashes. They're looking sick. Maybe they're uh, clammy, sweaty because their blood pressure is dropping, or they are uh, sleepy, because their neurologic system is being affected or so, or because their blood pressure is dropping. Those are kids that, obviously in those type of situations, you would want to seek care. If they're sick enough to seek care, you would want to call your pediatrician or call 911, depending on how sick they are. But if you do have kids that have fever, persistent fever, staying over 24 hours, they have those red eyes, they have some rash or so, you should definitely talk to your healthcare provider.
Red eyes mean like bloodshot red, like where the white part of your eyes is, or
Yeah, where the white part becomes injected, we call it conjunctivitis. You know how you can get like a pink eye,
Mhm.
basically, but it's not pus. There's no pus coming out. It's just they're injected. The lips can be cracked. The tongue can be very red. You can have swollen hands. There's a condition called Kawasaki syndrome. Also, there's something called toxic shock syndrome, and this seems to be mirroring those two, where the Kawasaki is an inflammatory response of the blood vessels, and because the blood vessels go to most of the body, you get a multisystemic response with Kawasaki also, including your arteries that supply blood to the heart can become dilated. They can become big, and they can be prone to a blockage and a heart attack or so for that. This illness tends to be more severe than Kawasaki, is what I'm reading, or at this point. But uh, thankfully, the hospitals are really good. I mean, the intensive care units, the intensivists. Thankfully, there are treatments available, basically supportive care. There's some other therapies that are being given, antibodies that are being given, just as we would do for something like Kawasaki. So, and like I said, there have been a few deaths, but the vast majority have thankfully recovered and done fine.
so what should parents do to prevent their kids getting sick from with this?
Yeah. So, you can't necessarily, the thought about this is, again, there were these 102 cases in New York. Not all of them were positive for coronavirus. But the vast majority were positive for coronavirus. That's why there's a thought that it's related to that. And they checked for other things, and they were negative for other infections or so. Um, and the thought is that this is an inflammatory response. It's where the virus may trigger the body to react, and it just does a massive reaction. Okay, which hurts the body itself. You know, I'm not sure if this is the best analogy, but say you have neighboring states. One state does something bad, maybe shoots a rocket over, and the other one. Um, Well, actually, that's not the best one. This is where you're actually hurting yourself. So the body has such a strong reaction that it's causing inflammatory reaction and hurting different organs in the body itself. Now, your question is, what can parents do about it? I mean, at the end of the day, it's what we have in our control, and what has shown to be very, very effective is what we discussed last time. Also, isolation. Basically, what we talked about, social distancing, uh, wearing a mask outside now. We didn't talk about that much last time because the guidance came out afterwards. But the purpose of the mask, wearing the mask outside, is so not necessarily that you become infected, but for you to prevent you to infect someone else. Because there's been a lot of cases of individuals that don't have any symptoms that they don't know if they're sick or not, and they may pass off the infection to someone. And that's the whole purpose of wearing the mask, is to prevent that or reduce the risk of that happening. Frequent hand washing, uh, keeping all the surfaces that we touch frequently clean, disinfecting them. Soap and water is the best. You can obviously use other disinfectants also that are effective. Hand sanitizer with at least 60% alcohol in it can be effective also to keep your hands clean. The masks in children, CDC is not recommending masks for children under 2 years of age just because of the risk of suffocating. The preference is to use the cloth masks. I mean, you can wash them easily, just so you have enough masks for the healthcare providers. Because the reality is, there is a chance that we're going to have a pretty strong rebound in the fall. And so we want to be prepared with our equipment for the healthcare providers, also the vents and everything else. Um, what else can parents do? I mean, this is it. It's what you guys have been doing so far, and that's what you have to keep doing because that's really what's going to keep the virus at bay. You want to control the amount of people that get infected until we have therapies to be able to attack it, or we have a vaccine to be able to prevent it, and then inshallah we can move forward.
So basically, you're saying that if parents don't have to go out and don't have to take the kids out, stay home and stay home with your kids.
Yeah, I mean, we're going to be getting more guidance about how things go. We're still waiting for these antibody tests. I know we have them. We're waiting to see if having antibodies is protective uh, enough where we can open up more and do more things. That's where the whole plan. And I'll be honest with you. I mean, I'm happy to be in New York State. I feel like the leadership in New York State has been. I'm not going to go back and talk about what could have been done in the beginning. I mean, I think everyone was caught off guard. But since then, though, things have been pretty organized and there's been good communication here in New York State. And it's a step by step with I'd say follow what the governor is saying, um, and um, uh, and see what's going to open up and when it's going to open up. And what's going to happen is that if things start opening up and the infection rates start going back up, we're going to have to go close back down again.
Another close.
Right. So I would look for ways to avoid people for the next year. I don't mean that like blatantly, but the reality is at this point we need to be social differently. We can be social this way on social media, but try to be away from people for a while so you can minimize the spread at this point until we have therapies.
Basically, we have to take this serious. This is not a joke. We just can't, say, hey, everything's fine and just start going out because we're bored at home. We have to stay home. We have to keep social distancing alive and relevant, basically.
Right. But you also can't, for it, it's going to increase anxiety, stress to be just cooped up at home. You got to be able to look at if you can go out with the mask on, get some fresh air, but stay away from people. You got to, go for walks. You have to do other activities if you have backyards or places where you can stay away from other people. You have to have some mental health time also. You can't just stay in because we are in it for the long haul. Keep doing what we're doing in terms of the measures, social distancing measures, and still try to keep sane.
No, that's really great thoughts. I mean, listen, I'm at home, at my dad's house, and thank God I have a backyard because I have two little monsters at home who are creating a muck. So I retreat to the backyard now more
Yeah,
than
yeah, and that's and that's why the cities, I think, closed down like 50 miles of street so people have more places to walk. Because that's important also. So if you have your own little piece of land or yard or so, you're lucky. I mean, but the city's trying to do that also. We're going to be here for a little bit. So getting back to that case, thankfully it's rare. We will be seeing more of them. Thankfully, the hospitals are pretty good at equipped to support the children so they can get through it. Obviously, the ones who have more underlying risks, even more uncontrolled asthma, I'm going to say it. I say to my patients, please, if you are prescribed daily medication for your asthma, take it. You don't want to get a virus and trigger your asthma and wind up in the hospital. If you have,
Doc, how did you know I stopped taking my medicine?
well, it's not something easy. I mean, a lot of people, it's hard to do, but it's going to be important to do that.
And so basically, if you're a asthma patient who you have kids and they're not taking their medicine, make sure they're taking their medicine. Call their pediatrician, get the refills that they need. Correct?
It's allergy season. Control your allergies so they don't trigger up the asthma. Obviously take extra precautions if your child has chronic underlying issues, health issues. You want to protect our elders. So, frequent hand washing. If you're sick, stay away from them. And speak to your healthcare providers if you have questions, if you have any symptoms about what's going on.
Dr. Ahmad, for our viewers, can you just tell us who you are and what you do for a living? I mean, obviously everybody knows you're a doctor, but what kind of specialist are you and what do you do for a living?
So I'm a pediatric pulmonologist and sleep physician. So I take care of children with asthma and other lung conditions. I treat allergies. I work with a wonderful allergy practice in Long Island. We have a couple offices here. I also work at a hospital in Brooklyn. It's been nice. Right now, mostly what I'm doing is telemedicine visits. I do go in for patients that need to come in, especially for specific shots to help control their asthma. I go in for those type of things. So, we're doing medicine differently at this point until things get better under control because we want it to be safe for our children, our patients, our elders. I do see adults for sleep as well as pediatrics for sleep. But it's a nice field to be in. Happy to be helpful in that regard. Yeah, I mean that's basically. I don't like to talk about myself too much, but that's basically what I do.
Listen, I know Dr. Ahmad personally. He's one of the best pulmonologists I've had seen in the last 27 years. And we really appreciate Dr. Ahmad for all the wisdom you embark on us and all the time you actually give us, honestly. We appreciate you so much. And to all of our viewers, Dr. Ahmad is one of the best pulmonologists out there. So if you need to seek anybody, Dr. Ahmad is the guy to go to.
We're always happy to help out, but thank you so much for your kind words.
No problem. And if you guys have any questions that you guys want to ask Dr. Ahmad from after watching this interview, you can definitely shoot us a DM or you can inbox us and we'll definitely ask them and get your questions answered for you. And Dr. Ahmad, thank you so much for giving us the time again. Honestly, really appreciate it and for the wisdom. And if you guys are watching this and you have kids at home, take this seriously because it's not only affecting adults, now it's starting to affect kids. So we want to make sure we keep our adults safe, our grandparents safe, and our kids safe because this is serious and we have to take this serious as a community because it's not a joke anymore.
One thing I do want to say is what we're trying to do now at this point, as a state and as a country, some states doing it better than others, is that we want to balance the work part. Obviously, it's important. The economy is important with safety. We're trying to balance that so that we can continue to do both because you can't stay home. I mean, I don't know if anyone who can stay home for the next year waiting for a vaccine or so. So just please keep an eye out. Listen to what your governors are saying. I agree with what our governor is saying. I believe also the head of Maryland, the governor of Maryland, has a good head on his shoulders, as well as one in Ohio, who are both Republicans. Governor Cuomo has a pretty good idea about what's going on also. So I would really pay attention to it and keep doing what you're doing. That's why our cases are going down, is because you guys are doing what we're doing.
Thank you so much, Dr. Ahmad, for your kind words and your wisdom. And guys, make sure if you go outside, wear a mask, practice social distancing, keep your hands clean, wash your hands, keep surfaces clean, correct?
Yes, anything that you frequently touch, you want to keep it clean frequently. Soap and water is good. Disinfectant is good.
Amazing. Thank you so much, Dr. Ahmad, for your time once again.
Take care.
And listen, we have anything else, we're definitely going to reach out to you to have you again, inshallah. Hopefully we don't have to, but if anything, if our viewers have questions, we're going to have you back.
I'll be happy to answer anytime. Okay.
Thank you so much. You guys have been tuned to Shakil and Company on American Islamic Radio. I'm your host, Kevin Shakil. Today we had Dr. Khalid Ahmad explain to us a little bit about what's going on with COVID-19 and how it's affecting kids. And if you know anybody that can benefit from this video, please share and like. We wish you guys the wonderful Ramadan. Assalamu alaikum.
Alaikum.